from the nurses was the coronavirus pandemic has led to a drastic decline in the number of mothers taking their children for immunization in the country. The Minister of Health says there has been a 20% drop in the number of children being immunized against diseases such as measles and polio across the country. For about 3 months now, mothers have shied away from hospitals over fears of exposing themselves and their children from contracting the Covid-19 disease. The government, in conjunction with the United Nations Children's Fund, UNICEF, has, however, moved to allay the fears through an outreach program that is finally bearing fruits. Kamche Menza reports.
9-month-old Kasim Kimani is today receiving his first dose of the measles rubella vaccine. Baby Kimani is among several children under 2 years who have slightly delayed in getting this all-important jab. His mother, Saumu Mohammed Saad, was hesitant to take him to the clinic after the first case of coronavirus was confirmed in the country in mid-March this year.
Nilikuja kwanza jana kuuliza kama niweza kuja. Ndio akaniambia unaweza kuja, basi unafaa kuwa umevaa mask na kuwa umekava mtoi vizuri kwa kulingana na baridi na iwe kwa hapa juu watu ni wengi.
Teresia Agisa has also brought her son for vaccination. Her delay, she says, was as a result of the effects occasioned by the COVID-19 pandemic.
Ningefaa kumleta immediately venye hiyo report ya corona ilifika Kenya. But sasa by then I had traveled kwenda home. So home pia kuna challenges, nini hospitali ziko mbali. Then dispensaries zenye ziko karibu. Nikienda walikuwa wanasema hawana hiyo nini dawa.
Unlike Saumu and Teresia, however, Goreti Akoth says her 1.5-year-old son was lucky to receive his first measles rubella vaccine in June 2020 thanks to a door-to-door immunization program.
Sasa vaccination hakupewa juu nilikuwa nimesafiri nimeenda nyumbani. Lakini nilikuwa nimesahau kitabu. Na huko nyumbani nilikaa sana. Sasa vile nilirudi ndio hiyo maneno ya corona vile ilikuwa ikakuwa nikaona kumpeleka hospitali labda itaniletea nini. Anaweza ambukizwa ama tunaweza pata maneno mengine tofauti, ndio nisikumpeleka.
It is a concern expressed by many mothers here, oblivious of the dangers their children are exposed to should they fail to get vaccinated in time. The Kibra DO Health Center serves most of the residents living in this sprawling informal settlement.
The mothers in the community are saying, si kuna corona sister, tutakuja hospitali alafu tupimwe. That was the story initially.
The global health crisis has left many mothers worried. This has led to a significant drop in the rate of vaccination in children under 2 years. Through the immunization program, Nairobi County targets 159,995 children under 2 years annually. This translates to 13,329 children vaccinated in a month. Also targeted are girls aged between 9 and 10 for vaccination against human papillomavirus that causes cervical cancer. In the months of April and May, the number of vaccinated children dropped by close to 50%, from 11,329 to 5,998 children.
It was difficult to get the mothers to come to the facility, so we had UNICEF supporting us to go and take services near to the community to see whether they will bring the mothers to the outreach services.
Kibra is one of the informal settlements that community health promotion officers targeted in the community outreach exercise following the dwindling numbers in the normal immunization program.
Inabidi tuingie kwa ground, tutafute wamama wale wa immunization defaulters. Kwa ukiangalia kwa register yetu ya hospitali, turn up imekuwa chini kabisa, hawakuji hata kidogo.
Kibra constituency has a total of 11 government health facilities. One of them is Kibra DO Health Center, which recorded a decline of 10% in the number of clinic visits. For instance, number of doses administered for pentavalent 3 at the facility in April 2020 was 30 compared to 2019, same time that registered 50 doses. Doses for measles rubella 1 administered in May 2019 were 60 compared to 43 in May 2020. For fully immunized children in April and May 2019, the numbers were 63 and 60 respectively. April and May 2020 recorded 47 and 43 respectively. Nurses in charge here say with the help of community health volunteers, the situation has improved. There is a steady rise in immunization services.
One of the critical health promotion messages that we were giving them during the outreaches is to tell the mothers that yes, there is COVID, but immunization is an essential service. If we fail to immunize our children, then we will control COVID, but we will have an outbreak of measles and polio.
However, the Ministry of Health admits hospitals across the country have generally recorded low outpatient visits for various illnesses and a 20% drop in immunization.
We've seen a decline in immunization services, particularly DPT-3, which is an indicator for immunization. We saw about a 20% drop of that. We've seen a decline in deliveries, but again with good news. In the month of May, and like I said, this report will be released soon, we've seen almost a normalization. So the curve went down drastically, but in the month of May, there's a resurgence to near normalization.
The situation in Nairobi County is replicated across the country.
With confirmed COVID-19 cases rising by the day, nurses in charge of immunization are calling for the adoption of more interventions to lure mothers into bringing their children to health facilities to get immunized. Kamche Menza for Channel 1 News at the Kibra Health Facility, Nairobi.